it looks like a self the treatment or self-healing is very popular in this session. Let me start with kidding Dr. Harris. I think the self-acupressure could be more difficult than just breathing. So today, let me introduce breathing here. So what is the volitional breathing? Volitional. So you always just you have always breathing, right? So that breathing has been controlled by the respiration center in the brainstem, which is called reflex breathing. But when you give attention to that breathing, and when you try to control your breathing pattern, and we call that's volitional breathing. So right now you can do volitional breathing as far as you pay attention to your breathing. So today let me report some our the lab's progress about that the beneficial effects of the breathing. So here for the research purpose, we divide two components from that volitional breathings. So one is, I think volitional breathing has multiple components, but here I'm suggesting two. One is motor control itself. So in terms of the motor control, there is a reflex versus volitional motor control, and the other one is attentional modulation. Probably the volitional breathing is internal attention or body awareness about their motor movements of the respiratory muscle. So there's two components. So I use that two components to explain my brain results. Okay. So why volitional breathing? As you know, in Qigong and yoga and other many treatment modality, including acupuncture. As you know, acupuncture can be synchronized with the breathing out and breathing in, exhalation and inhalation, for give the intensify or for delete that the power. Okay, so first that's volitional breathing, and volitional breathing is known to be effective about emotional control. So let me introduce that very briefly. Then also here the motor respiratory coordination. I named that because Qigong or yoga has been very focused about coordination between movement and the respiration. And third one is the somatosensory respiratory coordination. Then lastly, I briefly saying that self-brain regulation. So first, we have the so-called delayed match working memory task. So here you'll have four. Look at that. You'll have three phases in 4 seconds. So you are supposed to encode that phases in that 4 seconds. That means you have to memorize that. Then there is a more than 10-second hold period. So you have to keep that the phases in your mind, right? Then again, you have to retrieve. You have to prove that phase was in the the encoding the phase or not. So so what is it? Yeah. So maybe you have to press the button no, right? Because there's a no that phase. And using that the working memory the protocol, we introduced that distraction. So we gave them that very weird the photos, which is induced the emotional distraction. And this is one of our the control group, and for this one, so they are supposed to do the breathing control, breathing, whatever it is, with attention, while they are looking at that very aggressive the photos. So somehow they have more cognitive load because they have to concern about volitional breathing while they are looking at the emotional the photos. Then which group could have a better working memory performance? That's our question. And we have another control, which is neutral stimulation here. Okay. Then let me show you first how they breathe. So basically for here, emotional, the distraction plus volitional breathing, that VB, they have a deeper and slower, so deeper and slower breathing they have. But they don't have a difference in terms of the inhalation versus exhalation ratio. Then here, while the accuracy is almost the same, actually the emotional breathing, very strikingly, the volitional breathing, which is more cognitive load, they have a more accuracy, but there's no any significant difference. But look at this one, reaction time. So the fast one is this one. So they solve that the question faster than just normal emotional distraction. So when you do volitional breathing while you are solving your answer to that working memory task, and you will have a better performance. So that's our result first. So yeah, it was very surprising actually for me, because I was very nervous about our performance. Then when I look at the brain, and here the white one is the control, and the second one is just emotional distraction, and the black one is emotional distraction plus volitional breathing. As you see here, amygdala, which is known to be the fear or anxiety, the centers, let me say, definitely they have a more activity in the amygdala. But when you breathe, and you will have a decreased amygdala activity. So this one is the first one is control, and the increase and then decrease. So when you have a volitional breathing during the working memory task, and you will be able to neutralize that emotional distraction to the neutrally. So here my ROI was actually VLPFC and the amygdala and PAG. Why? The PAG has been known to be related to respiration as well as coping strategy and the pain, the metrics. So we did connectivity analysis. Then as you see here, we found interesting connectivities. That connectivity has been positively correlated with the working memory performance. So I could link the clinical outcome to the connectivity. For example, here between the PAG to VLPFC, this one, there is a strong correlation somehow. Okay, this one. So when you have a more connectivity between them, and you'll have a more working memory performance while you are breathing. So this is the first one, and we actually performed one additional experiment. So according to this one, we found actually we control many different components in terms of difficulties, but only emotional the distraction has been controlled by the volitional breathing. So it was very interesting. Okay. So about motor control, we had a Bell's palsy patient, and we asked them to do the motor tasks. But after 3 months, the Bell's palsy patients actually most of them are recovered. Then actually we ask them to do when they do motor execution. What I'm saying is motor movement, facial movement. I ask them to do coordinate their movement with the breathing. So whenever they move, and they should breathe in and relax, and they should breathe out, for example. So motor respiratory coordination. And we calculate the so-called motor respiratory coordination index. And look at this one again. When I ask them to do breathing, like the MRC is a motor respiratory coordination, and they have also the deeper and the slow breathing, even though I didn't ask them. And MRC index is higher than that one, control. Then interesting thing is, look at this one. So when the MRC index is greater and they have more recovery after 3 months. So probably when you do the rehabilitation for that Bell's palsy, and you might ask your patient to do that motor respiratory coordination, and you'll have a better performance, you'll have a better outcome. And when I look at it, the brain correlates, and there was a very strong difference activity in the posterior insula, which is one of the somatosensory and the salience network. And again, because I think they do more internal attention, more body awareness to their motor itself. So probably they will induce more the activity in the brain in the region of the body awareness or the somatosensory areas. So we got these kind of the results. So greater, the MRC index have a greater activity here, including the DLPFC. Again, this is about DMN network. So still, when you have a higher MRC patient, which has a better the performance in after the 3 months, they have more connectivity in terms of this one to the DMN networks, which is very interesting. So basically, I would say they when you do breathing, volitional breathing, you can have more the body awareness, and you can improve the cognitive performance in terms of the emotional control. And the secondary, we do. Let me introduce very briefly this one. So we investigate the effect on the sensory processing with the volitional breathing. This one is a little bit complicated. So we have 3 different groups, and this one is respiration-gated somatosensory stimulation, which means when you breathe in, and our automatic electrical stimulator give electrical stimulation. But this one, third one, is a little bit different. So whenever you have electrical acupuncture stimulation, and you are supposed to breathe in, right? So this one is more like a volitional breathing of the breathing, and this one it has been controlled by the motion, because motion detects your respiration cycle, and then motion gives you electrical stimulation. So in terms of the coordination, they are exactly the same. The timing is exactly the same, but this one has a more volitional, attentional control. Okay. Interesting thing is, in terms of the autonomic responses, I think this is SR has more sympathetic activation than other groups, while the control and RS has more the parasympathetic activation. Let me skip this one. Then there is interesting the result from the somatosensory area. Let me stop. Okay, so let me wrap up my presentation with this slide. So as I show you, maybe I can implement real-time fMRI neurofeedback with the ROI in the, for example, PAG to the VLPFC connectivity, and the patients, the strategy could be like a volitional breathing. They will be asked to increase the volitional breathing, right? Then they can increase the connectivity between PAG to VLPFC, which is very related to their working memory performance or other clinical outcome in the fMRI. So this is very preliminary the proof of concept, but I have been trying to be successful about this study right now for 3 years, but still I haven't had like any significant results so far, but yeah, I hope I can report very successful result at the next time. Thank you.